I'm going to start off talking about Far Northern Regional Center and the area that we serve. Far Northern Regional Center covers the 9 counties that I described in that graph. We're the smallest regional center in the state of California. Second smallest, I apologize. We serve, at this time it said a little over 7,500 clients. We've had some growth since then, and we're just hit 8,000 in the last few days. In addition to that, being the smallest regional center, we're actually the second largest regional center geographically. And our largest cities are Chico and Redding, with only about 100,000 people in each of those communities. Everywhere else that we serve is quite rural and predominantly white. And this graph actually shows the relationship of our community versus the individuals who work for the regional center. And if you can tell, the numbers are pretty close to corresponding to the community that we serve. So we all talk about POS disparities, and this is the whole reason that we're in this presentation. And just for those of you who may not have understood what we're talking about with POS disparities, this graph shows exactly what we're talking about. And there's 2 components of disparity. The first component is the amount of service that the regional center authorizes. And this is basically what the regional center says yes to. That's what individuals and families actually use, and that's a percentage of the number on the left. So if you take a look at this, you're going to notice, just like in every other regional center, there's quite a disparity between the white community that we serve and the Hispanic and Southeast Asian. So those are our target populations in the program that we're talking about. And I also want to explain one thing about Far Northern that needs to be discussed in this one. When you look at the lines for the Filipino community, that is actually statistically not useful in this because we had a couple very high-cost individuals that represented that community, even though we serve less than 100. So our biggest issue, because of our population demographics, is with the Hispanic and Asian community because they constitute the 2 largest non-white communities that we have at Far Northern. And this disparity was from 2016 to 2017. So in order for the regional center to figure out what we wanted to do and to develop some sort of plan to rectify the situation, or at least to make this make families receive services and request services as close to possible from what white people do or white families do, we needed to meet with families. So what we did is we decided to set up several focus groups, and this was in 2017, before the ABX2 grant came out, which is a diversity grant that the legislature approved in 2016. So we met with a number of families in our predominantly non-white communities: Oroville, Chico, Orland, and Gridley. So these are the information that we came up with and issues that we needed to address at the regional center. There was a number of different things that families came up with, and they all had broad themes. The first one, which actually to me was the most surprising. I had always assumed that language, especially for our Hispanic and Southeast Asian community, would be the primary issue. And that was discussed, but primarily people talked about the lack of information. Families consistently told us that they lacked information about what the regional center is. What does Far Northern do? How can they benefit my family? Why are you even here? Why do you show up at my house every year or so? Families had a lot of concerns about disabilities. If your primary language is not English, families would tell us that all of the lectures that people receive about autism, about intellectual disabilities, are in English. There might be some literature out there, but they don't get the in-depth understanding, being able to talk and ask questions of professionals. Families did not have any idea of what resources were available in their own community. A lot of information was not available in Spanish or Hmong. Even though we all think that we were doing a good job, families said that they wished there was a lot more going on, or a lot more information. And then misunderstandings. Misunderstandings were a huge component of what families talked about. They didn't understand what the relationship of the regional center was to the federal government, to the state government. Did the regional centers, are we a part of county government? Did we report to CPS or to immigration? It really ran the gamut because people really did not know our place in the world, especially the world for their family with disabilities. Then we talked about the language barriers. Language barriers were a real problem because even though that we could authorize services, families told us they wouldn't access services because our vendors lacked Spanish-speaking staff or Hmong-speaking staff. We have a problem in our area because in our area there is not as many individuals who speak other languages, so those people who did have great language skills would get hired in other entities like the county government or city government, and our vendors could not provide competitive wages. Then there was a problem with, I believe, a commitment to bilingual staff. A lot of our vendors say, yes, we hire bilingual staff. Yeah, we have this number of individuals work out in the community, but there really isn't a lack of commitment to train those individuals or really to provide quality service. One of our respite providers, a very large respite provider in the Chico area, up until just recently had one person who was coordinating respite for several hundred families who spoke Spanish. But this person only did this as a part-time position. They worked in the day program, and 2 or 3 times a day would have to run to the office and check the voicemail. So families never actually had a live person that they could talk to schedule respite or talk about respite services. And to me, that was indicative of what we're talking about. A lack of commitment. You might actually hire that individual, but there's more than just hiring that person. In addition, and this came up a lot, is families felt that they were really isolated. First of all, they were isolated because their child or their family member had a disability, and it was much harder for them to socialize with others. But then you add language on top of that, and there wasn't, parents felt really isolated. We had a number of parents that some of their simple requests was support for the mother. Mother would be home with the children, father worked more than 45 hours a week, and they were home without a car, and they had no social support. And no one who can truly understand what they were doing as a parent with a child with a disability. Other issues that came up in our focus groups were trust. Parents said that they were unwilling to use respite because they didn't want to trust unknown respite workers. So the way a lot of the respite providers in our area work is the family calls up for respite, and unless that family member has somebody they're identified, they just send over worker after worker until the family finds someone they're comfortable with. Well, in a lot of families, a lot of our non-white families, this was completely impossible for them to accept. They only wanted somebody that they truly trusted and knew who could work with their children. Families also said that there was a cultural difference in some of the services the regional center provided. Out-home placement or residential care is rarely used by families who are non-white, especially the Hispanic community, because as one parent told me, we take care of our own. This is not something that we typically do. We don't want somebody else to take care of our child, no matter what the disability is. Families also felt that it was their own responsibility to provide respite, and it wasn't something that they wanted other people to do. Again, there was this overall distrust of government, which I've talked about earlier, and through the misunderstanding issue, families didn't trust. They perceived the regional center, even though we are not a governmental agency, as a governmental agency. And again, that created issues with fear and whether we would report to agencies that could cause immigration problems for them or other family members that they knew of. And just plain distrust of government and any of those services. The other one was fear of using services. Some families felt that if they used service, that was an admission that they had a problem. They also felt that if they did utilize services, then that could be held against them in other entities with other people down the road. And then overall, there was a strong sense in these communities that we're self-sufficient. We need to take care of our problems, and it wasn't something that way they felt comfortable asking for help. The next issue that came up was a discussion about other services or services that are not available through the regional center system. One of the most common ones was the socialization program. So for those of you who are maybe not familiar with a lot of how the regional center works, in 2008, there was a budget cuts throughout the state because of the financial crisis. One of the things that happened at that time is that the legislature prevented the regional centers from providing social services, socialization, social rec, activities similar to that. Families really decried that, and they wanted some sort of sports program. When we talked about the idea of respite to these families, families said, well, that sounds great, but you mean my child's just going to have a worker who's going to sit and watch TV with them. I want them to actually do something to get out in the community. Maybe they can go to a sports game, interact with other kids who are disabled that speak Spanish or Hmong. So the other one was, and related to that, is to address the isolation and the lack of social opportunities for a lot of the families that we served. And families also said that many of the services, such as respite, out-of-home placement, didn't really fit with their culture. So when all of this information was gathered together, state of California passed the ABX2 law, and this was in 2016, and it was to create a grant program for regional centers to apply for to create unique and specialized grant projects to address the diversity issue. So when we received the grant, and our grant was for $671,000 to develop a PROMOTORAS program, we sent out an RFP, and it was awarded to the Northern Valley Catholic Social Services. We targeted the Hispanic and the Hmong community at the Far Northern Regional Center area. That's the two largest non-white communities we have, and definitely the two communities that have the greatest POS disparity. So our PROMOTORAS design really consisted of a number of different things that we wanted. We wanted the PROMOTORAS workers to act as service navigators, to assist family in, first of all, utilizing services that they've already had authorized, and also to help families identify the needs that they had that may have been overlooked, and things that they can ask the regional center for services, and to meet unmet needs. We trained them, all the PROMOTORAS workers, in the IPP process. The PROMOTORAS workers, as a part of their employment, are required to go into the 2-day person-centered planning training so they can help understand needs identification, work with families to help them understand what services that they're supposed to get and what they could get. And then advocacy. All of our families expressed apprehension about requesting services, things that they don't want to make their service coordinator mad, that they don't want to step on somebody's toes, even fears that if I ask for too much now, I won't get something down the road. So we have to work with families on that. In addition, our PROMOTORAS workers are really focusing on community mapping and looking at services that are available in the community, whether they're regional center services, generic services, or whatever. So the program design that we set up was additionally to that, we wanted to create a community information education series. So if you recall earlier, I said families had issues with the fact that they didn't have information about regional center services and disabilities. So we are doing a rotating series of educational and information sessions for families. We started off with an FNRC orientation to services. This was a series that I coordinated, and we went out, go out to our communities. And when I say go out to our communities, this was a huge component of our program. Families always complained that most of our service, our education to families, were provided in our large communities in Redding or in Chico. And although really good for us because that's the huge population centers, the vast majority of our non-white community lives elsewhere. So what we did is each one of these series goes to every single community in our area that people requested it and have a large non-white community, or Hispanic and Hmong. In addition, we've also did a series on captain and autism services, focusing on evidence-based practices, and to give families ideas of what works for their children, tips that they can use. In that vein, we've started a behavioral tools training, a nurtured heart training, and in the midst of all of this, we're working in collaborative with Social Security, IHSS, Office of Clients' Rights, and the State Council to provide ongoing trainings, all of these in Spanish and in Hmong. So we also wanted to talk about an elimination of barriers, or barriers that may affect the reason why there's a disparity in the first place. So the training of the PROMOTORAS, we decided to train PROMOTORAS workers to be first aid instructors. The reason we did this is families came to us and said there was an issue. They could not access nursing respite for their children without having a respite worker that had training in first aid. So our PROMOTORAS workers are going to be certified first aid workers who can teach it in Spanish. We also work with them to address the apprehension, fear, and stigma that families express about having a child with a disability, help them identify service needs, and then assistance with paperwork and the bureaucracy. And that's been a huge issue with a lot of our families, is the system, not just the regional center system, but social services in general, can be very complex. And families sometimes need help just with the paperwork and navigating what they need to do. So what we learned so far is most of our assumptions or things that we found in the focus groups were spot on. We hit every one of them, and it was very true. Families said often that our services and policies don't fit with their culture, and ultimately this is the impression I have to say, because when I was studying the Lamron Act, regional center services were designed 40 plus years ago, by and for white middle-class families. Respite is the most beloved service that the regional center provides, but then that's beloved by the white community mostly. Natural supports and culture is important. We have to look at what works for the culture and not look at just one size fits all from everybody. One of the other things that's important is to realize high-cost services sometimes are not possible for some families. Regional centers are one of the unique entities throughout the country in that our services are not means tested. So we provide the same level of service for a multimillionaire that we do for someone on welfare. There is no means test in the regional center system. So if you're looking at a bathroom modification, which is one of the largest things that Far Northern does for families right now, that can cost the regional center $25,000, $30,000, $40,000 to modify a bathroom so that a person with a physical disability can actually use their bathroom. But you have to own your home to access that service. Wheelchair lifts are another example. We will fund a wheelchair lift for a family who needs a wheelchair, their client has a wheelchair and needs to transport to day program, doctor's appointments, what have you. Again, you have to own that van. Regional centers are precluded to buy that. And it actually has to be a relatively new van because we're not going to put a lift in something that we may have to replace later. So our system is extremely complex and difficult to navigate. I can go on and on for that one. Regional centers often lack the ability to address unique needs. I'm hoping with self-directed services, if those of you who have heard about that can address some of those issues, but also there's a structure at the regional center. We have to have a service code and a subcode for everything that we buy, and if that line doesn't exist, we have trouble finding that. And there are other issues at every regional center with a bureaucracy. And we could be more flexible, but the structure sometimes doesn't allow that. Services for children are often are quite limited. And this is one that a lot of people don't realize. Once the child turns 3, and all the way up to 22, regional centers are much more of a bit player in families' lives because the school is the primary delivery of services at that point. We can provide respite, we can provide summer camp, but a lot of the important service needs are educationally related. And then we have problems addressing diversity in rural communities because basically we have providers that we cannot find to go up to communities that may have 300 people in that town, 2,000 people in that town, because they may have a base of clients they can work with that is just a handful. And we need transparent and clear policies to be able to, for everybody to understand. So I'm going to try to speed through some of this, but this is an important part I want to talk about. So this is a definition of cultural capital from a sociologist named Pierre Bourdieu. And I'm not going to read through that because that's a really complex definition, but it is actually the best definition you'll ever find. And cultural capital is really important. My example of cultural capital, because I grew up with a relatively poor family, and I lacked cultural capital even though that I'm white. But of course, there's always much differences in how that goes. But my example was when I was in college, I was in all the way up until my sophomore year in college until I realized that going to see a professor in office hours was a good idea. I thought I was doing him a favor by not bothering him and proving that I understood what was going on. I had no clue that that's how you got chosen for projects or other things. It took me 3 years of college to figure that out. Now, if my father had actually went to school and went to college, I would have learned that. That's a small component of what our families deal with in cultural capital. And then I'm going to finish up with one of the last things that I want to talk about. We had two families that I dealt with in the last several years that really given a good example of this. First one was this white upper middle class family that lived in Chico. Father was a professor at Chico State and mother worked for the school system. Their child turned 22, needed to go into adult services. They presented the regional center with a plan of what they wanted the regional center to fund on her day program that was different than anything else we'd done. They did the research about the laws saying that they were supported on that, provided us with other examples about that, and then threatened to go to fair hearing if they didn't get what they wanted. Obviously, they got what they wanted. Obviously. Second family was this Latino working class that lived out near Orland. Their child was recently picked up with a terminal illness. And this child was very physically challenged. We met with them and went over what their needs were, and one of the first things we provided was nursing respite. That father's reaction to that was, first of all, to start crying because his wife was under a lot of stress. And then he stood up, pulled out his wallet, and asked us how much he owed us. Regional centers we do everything for free, and that was, of course, a glorious thing to tell people that, and tell this family that. But in my mind, we can never solve this issue until the second family sees the possibility or even comes close to what the first family saw. So these are just my little editorial things. Common ways to encourage multicultural understanding or promote diversity have limited benefits. And focus on food and celebrations. When we talk about the diversity, and we first got into this, and a lot of the ideas with PROMOTORAS that I'm talking about, not everybody, vast majority of people's ideas was we need to have a party. We need to have a celebration. It's beautiful and it's nice, but diversity is not solved through eating tacos. Interaction with community leaders and focusing on community leaders. If you focus on community leaders, it can be really helpful at times, but you have to be really careful with that. In the Hmong community, that is a really good entree into the Hmong community, is to work with community leaders. In the Hispanic community, what we've learned is it has its benefits and it has its detractions too. And honestly, you should probably work on both ends of it. And then cultural competency trainings. Unless there's a follow-up and an ongoing discussion of cultural competency at the organizational cultural level, a one-time cultural competency training is more likely to create anger and frustration than it's actually to solve anything. So I believe in a ground-up approach. Person-centered planning has been amazing. Be creative as much as possible. You're only going to solve this one person at a time. And always, always look at what you're doing in your own internal process to see if you can deal with issues of bias. And that's my presentation.
My name is Carlos Hernandez, and I'm the cultural specialist at Valley Mountain Regional Center. Okay, I would like to tell you a little bit about myself. Okay, so I was born in Bakersfield, California, to Latino parents, and I have a brother who's in the developmental disability community. Okay. I grew up with a family where we didn't have the luxury to have our own translator. So guess who was the translator? I was, okay? So I was dealing with the regional center in Bakersfield, California, and this is where some of my passion comes from. I remember translating. I remember a few conversations that my mom would have with the service coordinators or the case managers, and she would say stuff like, I remember an 80-year-old saying, my mom would say stuff like, hey, who told you can speak for me? My mom would tell the service coordinator, and she would want me to relay the same message with the same passion. Well, I was 8 years old, okay? So a lot of my experiences are coming from my own family, and this is why this is so important to me, because I remember my mom seeing her cry and being scared on the weekends while our caseworkers go home. I've had somebody who's told me, well, I've been working with this community for 40 years. That's great, God bless you, but you will never understand unless you have a child with developmental disabilities what it's all about, okay? So, because we are pressed in time, I will keep moving. At VMRC, we serve 14,000 individuals. We serve 5 counties, which is the San Joaquin County, Stanislaus County, Amador, Calaveras, and Tuolumne. Okay, this is the Central Valley. The 3 groups that we've identified as being the highest, of course, is the Caucasian group, where they're at 37%. The Hispanic group is 35%, and the Asian community, which is 6%. The data that we are looking at is this, okay? If you look at the far right, you will see that the white community is at 16,000 in POS comparison per capita. So my question is, well, what's going on with the Asian and Hispanic? The Hispanic is at 8,000 and the Asian is at 10,000. Why? We're not wanting to take any service away from anybody, but why aren't they at the same plane? So sometimes this data, and that's why I don't come with a lot of data. We have plenty of data, but it doesn't tell the full story, okay? Like Mr. Larry mentioned, he actually did the whole presentation for me, so I could actually say goodbye and see you guys later. But it's true. The system wasn't meant for people of color, okay? My mom had a difficult time navigating. We didn't even own a computer back in 93, 92. So it's very difficult for families, especially underserved families, to find services. We have, before we started this program at our regional center, we were telling people, hey, the program, the Disparity program, we were telling people, go to Facebook, go online and find out, look at the information. Well, a lot of people don't own computers. A lot of people can't afford internet. Those are the issues that we had to come by and sit down and say, well, how can we fix this? How can we get this information across to people that aren't able to reach out for this information? The next slide shows that from starting the Disparity program, the ABX2 grant, we applied for a couple of grants and we did get them, and I'll get into it. But here you can see that the Hispanic and Asian have gone up. The POS change has gone up. So we have a lot of people that are actually getting informed and using this information and our services. Sorry. Okay, now the important thing. What are we going to do about it? What's the regional center doing about it? Disparity is not a new thing. It's been going around for a long, it's been around for a long time. But I'm actually happy that now, with this political climate that's going on, and it's scary for our families, that we're actually doing something about it. So VMRC, the regional center, said, well, you know what? We got to start within ourselves. What are we doing wrong? We're hearing all these complaints. I'm sure every regional center hears parents saying, you guys aren't communicating with us. You guys aren't providing these needs for us. So now it's time to look at ourselves. Well, what are we doing wrong? What is it that it's not getting through, or how are we not communicating with these families? So what we started with first was expanding our family and community outreach. Since we started this program last April, we probably would do 3-4 outreaches or events outside in the community a year. We've done 160, okay? So we've spoken to people, we've purchased merchandise to give out. Another thing is if you have a lot of information in booklets with full of information, that's great. But I'm not gonna, and I'm talking about me personally, I'm not gonna stop by there and read your information, okay? You need to have something to attract these people. So what do we have? We have snacks, we have food, we have giveaways, and guess what? My booth is full of people. So we have to come up with tactics, okay? So that's what we've been doing at our regional center. We've spoken to several amount of people, and it's been showing because at our, when we have meetings, we have a room full of 40 Latino families, when before, when I first started 5 years ago, we had 0, okay? So the information's getting across. We're also training in person-centered thinking and planning. That's been a difficult thing to do because training in person-centered is it's nothing new. We've been doing it all along. It's just people with more experience than me that have been at the regional center think, well, why are we getting trained in this? We've done this for a long time. We don't need this. The thing is, it's time to change. We need to adapt to change. Let's learn new techniques. Simplifying and translating all documents, okay? We applied for the grant for that, and we were having people sign forms, cover forms that were all in English. That's like you going to a car dealership and signing a contract and you have no clue what it says. I'm just taking your word. That's a huge problem. What did we do? We invested in a company, or not invested, but we actually contracted with the company to print all these documents in people's languages. So we've printed all our documents in 18 languages, from Urdu to Spanish to Assyrian to you name it, we got it. VMRC also added 4 referral specialists, Spanish-speaking, for intake. Before, in that department, they were getting 2 to 3 calls a day of people inquiring information. Now, according to them, we're getting 10 to 12 calls a day. And it varies, but we're getting people that are actually interested and not afraid of the regional center. What I mean by afraid of the regional center is, imagine being a young mom, okay, and you have a child with this, you just been told that your child has autism. Now you gotta go to this huge building, and you gotta wait about a month till a doctor gives you a diagnosis and tells you, hey, we're gonna provide these services. How scared would you be? Imagine you being a mom that has no legal status. You're afraid. I had a mom, when I worked as service coordinator, give me a napkin and say, hey, I want you to sign this napkin. I wrote that you will not talk about my personal stuff to the government. You will not sign anything. They are scared. People are scared. The Hmong community, they are very private. Mr. Larry mentioned that it's very difficult and you have to be a trusted member of the community. That is true. One of the things with the Hmong community is they believe that they do not want to let you know that their child has a disability, because if others find out, it's karma. That means that that child that has a disability probably in the prior life was a bad person. Can you imagine feeling like that? That's what we're dealing with. We're dealing with people that are scared. So that's what we're doing at the regional center. We're sitting down and thinking, okay, well, what can we do to attract this, to convey this information to them? They don't trust us already. They think we're a government agency. How do we do that? We started a program, the PROMOTORAS program, but we felt like tweaking it up a little bit more. You see that it says Proyecto Esperanza Leadership Training. We felt that it's not enough just to train families. Let's show them how to do it. Let's find agitated mama bears that are ready to fight for their children, okay? That's what we're looking for. You don't mess with mama bear and her cub. So let's give them the tools. Let's just not teach. I'm not too important about you guys learning the data. I am passionate about you guys understanding and knowing that, yeah, there is a huge problem, and we need to do something about it. So what the regional did is we contracted with Proyecto Esperanza, who teaches leadership. And what does that mean? We're not going to go marching. We're not going to do any of that. What this does is, as a parent, it shows you, okay, alliances. Alliances is a great topic because you get to build a team. And one person can't make a difference. We need a team. We need a huge team. And that's what we're doing. We've started in our 5 counties, we started community groups of Latino parents. Our biggest group has 80 people that come in every 2 months, okay? And what they do is these parents are being trained on regional center services where they will teach other parents, okay? It's a parent-to-parent teaching. The only reason why I get it far with families is because I have something to share, and that's a story about my mom and my brother, okay? I tell them about, I know what it is to be, it felt like I was a neglected a sibling, but it's because my brother needed a lot of help. And that's what I convey to the community. So we build that trust, we build that bond, and we're taking over our cities. We are talking to the regional center, collaborating together, talking to outside resources, and finding new ways. Respite is the biggest thing, and you'll hear that from all the regional centers. We love respite. We love offering respite. But my mom would say, no, I don't want any strangers in my home. It's my duty. In my families, it's a religious type of view where it says, you know, God entrusted me this child. I vow to take care of this child. That's what I'm going to do. Okay? So we need to have that understanding. And if we can't offer respite, then let's find other situations. Let's give them other services. That's what we're doing at the regional center. The second, if you see ICC Collaborate, we met these awesome women from down south, okay? They're mothers of regional center clients. And they have started this movement. And they have everybody's attention right now. So what we've done is we collaborated with them to come to our catchment area and start working with our parents, start going to IEPs. IEPs is one of the most, it's one of the things that parents complain the most, okay? Nobody wants to have a case manager that goes to IEPs and just sits there and, oh yeah, I agree with the school, yes, 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 let's go ahead. No. Parents want to have that support. If we're the last line of support and we're backing up these parents, then we need to know what we're talking about. So at the regional center, at our regional center, we're also giving our staff IEP training. That's what we're doing. We're teaching these parents, not only their parents, because it's not only their responsibility, as workers, case workers, mandated workers, it's our responsibility to know what we're talking about as well. Okay? Sorry. Okay. So in 2017, we had this cultural connection event, okay? It is the first event that we had thrown that was this big. We were kind of scared in the beginning because we thought, well, how can we bring these people? Not only was it scary, but getting up here and using terms like white, Caucasian, it's scary. It is very scary, and let me tell you why. I was born in this great country, okay? I've served in the United States Air Force, the best company in the world. And I've never, thank goodness, I've never experienced in my life, I haven't any discrimination. In the military, it's either black or white. That's it. It is what it is. But I've never seen injustices as I've seen now working at the regional center. Not within ourselves, but with schools, with resources that are being funded by our tax money. Companies that are being funded and they're not even helping these families in need. So there's a huge problem in our system. And it's just, They say usually that in this group, in this amount of group, there's 10% of people that will do something about it, and then the rest will just sit there and let that 10% work for it. Well, it's time to change that. It's time for us to start educating ourselves in Lanterman, which is outdated and needs to be rewritten, and backing up these families who have a huge disservice. I mean, that's really what it is. We are not helping these families. We're trying our best, but when the state has you by handcuffs, what do? So it's not only time to have us, the regional center, accountable, hold us accountable, but also the state, our leaders. They only see numbers. They also need to study the reason these numbers are so high. Okay? Anyways, because time is short, the cultural connection, we had a great turnout. We had 722 people attend. Okay? The next slide, I have some pictures, and I made a huge mistake because we were running around. I parked this little police car right next to the immigration booth where we had actually had 3 attorneys to help out with services. So I see a little group of Hispanics standing there, and I go, hey, what's the problem? Why don't you go and talk? We're giving free legal services. There's a cop car right next to it. Are they just going to round us up and pick us up? We couldn't move it, but I explained to them it was just a show car. But anyways, just some fun and laughter. It went great. Here are some more pictures of the event. We had 3 attorneys to help with legal statuses. We had haircut sensitivity because a lot of children with autism are some of them don't like haircuts. Or it's not that they don't like the haircut, but they don't like the sound of the clippers. So we had special people that come in with shears or scissors and do their magic. We have over 40 resources. We had clients' rights, and we informed these people about them. We had some care facilities there that provided services. You mentioned care facilities to a mom, to a Hispanic or a Southeast Asian mom, they automatically think that we're trying to take their children away from them. Automatically. Oh, no. I swear I'm a good mother. That's not the case. It's just extra help. Okay? But we need to desensitize and actually explain everything. Explain and show them. Community outreaches, like I mentioned, we've done over 160, and we are everywhere. We're outside the Buddhist temples. We're outside of the families' homes and doing barbecues, and we are going to their spots. We're going to where they feel comfortable. Barriers that we've noted, the first thing I mentioned is IEPs. A lot of families are complaining that staff go to IEPs, which is individual education plans, and just sit there. Just sit there. Either they don't know the job or they are just humble and they don't want to say anything or they don't want to ruffle some feathers. But these are families that are suffering. These are families that feel they have needs. The second is families focus on economic survival instead of seeking services. That is a huge one. My dad was one of the guys that never went to my brother's IEPs he was never at anything because he had to provide food on the table. One of his best sayings was the regional center going to pay my day? Just have your mom go. We see that a lot in this community. It's like my whole childhood being replayed. So I see that a lot. Not understanding a child's diagnosis. I met a parent the other day who her child was diagnosed with autism. She's been a member of the regional center for 7 years, and she goes, I don't even know what autism is. My brothers won't even bring their kids to play with their cousin because they feel that it's going to rub off on them. Okay. What's the regional center doing about that? Why haven't we explained that? Appropriate language translation, like I said, we have documents that weren't being translated, and we have translators that do not speak the appropriate language, like we did in Florida. Remember that ASL, that sign language lady that was doing that for the police officers? What's going on? Aren't we testing these folks? That's one of the major things that I want out of regional centers to happen. Let's test these folks on language. We should have been doing that from the beginning. Families not understanding state and federal laws. We haven't explained that to families. A majority, 90%, probably don't even know what the state or federal laws are. Families have lost trust in the system. They automatically tie the regional center with the state, so they don't trust us at all. But we're starting to build that trust. Legal status may make some people wary of requesting services. It's scary. In Modesto, where I live, we have ICE pickup nights where they have the checkpoints and they're just rounding up people. So people don't want to come to our center because they're scared. We started a new program called Cafécito con el Jefe, which means coffee with the boss, building relationships one pan, which means one bread at a time. So basically what happens is we round these families up and we sit with the director and the assistant director, and it's open. So families have time to either communicate with him and tell him how they feel. We put cell phones away, all calls are hold, and all the attention is on the director and on the families. And it's incredible how many families have signed up already. Why? Because we've opened that door. A few years ago, directors wouldn't even meet with families because they knew they were going to complain. I'm not talking about mine, I'm just talking about other. But, so we started this program and it's working great. We're bringing info to underserved communities. We're actually going to their spots. Here we are in summer. I'm a big guy. I'm standing there providing a training at a park. Okay? So because, like I said, a lot of families don't want to come to the regional center. They feel that it's not welcomed. They feel that we're a government agency. That's what we're doing. We're going to people's backyard. We're taking this information to them, and we're building up leaders that will train other parents to be leaders. The last slide that I have is what Mr. Larry mentioned, is trust. Carlos, how is it that you build great alliances with these families? Families could care less about your vocabulary. Families could care less about how you look. Families could care less about your social status. What are you going to do for my kid? That's what matters. How do we build that? By being reliable. If we say we're going to do something, let's do it. If a family wants something done, let's call them right back. Let's stop being unbiased. There's a lot of people that say, wow, well, these people want. Well, how do you know? Do you have a child that has developmental disabilities? No? Okay, then you don't know. Okay? That's what I hear a lot in our community. And it's being heard within our infrastructure as well. Okay? Let's be consistent. When we start off as social workers or caseworkers, we have that fire to help everybody. But it gets to a point where there's people that have been there 30 years and are like, I'm waiting for retirement. I'm just going to coast. It's true. I see it every day. Communication. Let's keep communication directly to families. There was a huge complaint that came in, that it takes 2 weeks for a Latino family to get a call back from their caseworker. But when it's a Caucasian family, 2 business days and the call is being made. Why? Because the Caucasian families will not take no for an answer. They know the law. And what I mean by that is, if you tell a Caucasian person, you know what, we're not going to give you 30 hours of respite. What do you mean you're not going to give me 30? No, you will give it to me, and I'm not going to take no as an answer. You tell our families, I'm sorry, ma'am, you're not going to get 30 hours. What do they say? Okay, thank you. You're the professional. You know. That's what happens. Empathy. Have an empathy. Let's have a heart. If we're in this field, then let's help people out. Okay? And collaboration. Let's work together. It doesn't matter what your religious, it doesn't matter what your politics are. We're in a field to help children and adults with developmental disability. Let's do that. And that's it. It's building trust with the community. That's how we're going to change things. Thank you.
Okay, I am Helen Thomas, and I represent the Alta California Regional Center, and I am the Cultural Diversity Specialist. I had my experience with the Regional Center of Alta included having a child that was born at 6 months at 1.2 pounds, and she benefited from the early intervention services until she was 3, and she's doing great right now. Yeah. So Larry and Carlos have talked a lot about how there is an ongoing disparities, or we call them variances in service access and utilization among different ethnic groups served by the regional center. And as Larry had mentioned, the legislature mandated regional centers back in 2016 to hire cultural specialists. And that's where we come in. And with the hiring of the cultural specialists, there was also the mandate or the money given to the system, $11 million for the system to start implementing culturally related activities to reach out to the communities. And so that's why you've heard from them and from me as well, the different activities that we're doing to try to make ourselves known to our community and try to educate the families that we serve about the services that are available to them that they may not be using. And as Larry and Carlos have mentioned, it could be a cultural issue, it could be a trust issue. And I'm going to talk a little bit about what the state is doing about that as well, so that there is hope. So for Alta's population, you can see we are about 50% Caucasian, and then the other 50% is composed of African American at 12%, and then we have the Hispanic population at, it's not showing there, but we have Hispanic population at 17%, and other ethnicity or multicultural race, 12%, and our Asian come in at 8%. This is a comparison of the 2017 and 2018. And by the way, I wanted to emphasize that the categorization of different ethnic groups into a particular race is not done by the regional center. It's mandated by law, and the Department of Developmental Services handles all of that. And so we are 50% Caucasian, and then the rest a mixture of different ethnicities. And our purchase of service, this is also mandated by the legislature, and we show this. Our website contains data about how different ethnic groups utilize or access services from the regional center. What this is similar to what Carlos has shown, is different. These are different groups. We have the blue bar representing the white population, and but the black, African American, orange, and then the yellow, other ethnicity, and then the Hispanic, the gray, and Asian blue. And you see that it's pretty consistent, the way everyone uses regional center services. The white, the Caucasian population, this is for all ages, utilize the most services, and then you have African American next, and then the Hispanic, Asian, and other categories are pretty much using services in the same kind of pattern. So we don't really understand why. I mean, really, there's no data right now out there, a study that explains why there's the disparities or variances. However, the state, the Department of Developmental Services commissioned a study, and it's ongoing right now, and that's trying to understand, digging into the data, quantitatively analyzing the POS data, and at the same time investigating why there is these variances. So hopefully we'll have something that is tangible that we all can look at and say, okay, that could be it. That could be the reason why. I mean, we really need that data, because in order to change legislations, in order to change or make an impact into the community, the legislature needs that hard data. So hopefully with the DDS study that the Children's Hospital of Los Angeles is conducting right now, we'll have something tangible that would come up in a year or two. And Alta participates in that study. We are one of the regional centers, one of the 8 regional centers that are participating in that study. But as of now, just like all the other regional centers, we try to be responsive to the needs of our population. We have a diverse staff. That's one that we really pay attention to. The Hispanic population is our the largest ethnic group that we serve. We have about, out of the 80 staff that are bilingual, 44 of those are Spanish-speaking. And then the rest, we have somebody that speaks Hmong, Tagalog, Punjabi, Vietnamese, French, Arabic, Lao, and Russian. And so, just like Larry and Carlos, FNRC and VMRC, the ALTA was also funded to do some culturally related activities. And our regional center chose to have the electronic interpreter system, the headsets, which we make available during public meetings. So if the meeting is conducted in English, we pay an interpreter to come and do the interpretation, and the families have their headsets. We also translated a lot of the guides. We have children's services guide, adult services guide, transition guides that are translated in 7 different languages, and all of these guides are available in our website. The languages are Hmong, Spanish, Korean, simplified Chinese, Punjabi, Russian, and Vietnamese. So we have those available on our website. We've heard from the families that a lot of times they don't know what the regional center offers. And so the guides will give the families the literature, the information on what services are available and how to access them. We were also funded for outreach. Carlos and Larry also talked about going out in the community. We have funding for those. And we're going out, we're conducting sessions, information about regional center services. We're targeting our Hispanic and Latino, Hispanic Latino population, and then the Hmong, just like FNRC as well. And we did that because, as you can see, as you saw earlier, the Hispanic Latinx population, the purchases, they have a lot of purchases. They have purchases, but it's not as high as the African American and the white. And a lot of times they're authorized services, but they're not used. And so we're wondering why that is. And then we chose the Hmong because out of the Asian populations that we have the most Hmong clients, but they also have the highest number of clients that do not use services. So out of 151 clients, 71 don't have POSs. That's about 50%. So it's like, why is that? So they are our targeted population for our outreach. And we were also funded for cultural competency training, and Larry mentioned that if it's a one-time training, you're probably gonna encourage anger and resentment. And so we were aware of that. We did a focus group discussions with our service coordinators to get their ideas on what they would like to learn about. And so we were able to do a foundational cultural competency training that was provided to us by the UCD Extension, Dr. Porter. He was excellent. He was very dynamic and interactive, and it was very well received. And we're also able to provide culture-specific trainings, which was also very well received by our service coordinators and the providers. We did a training on the Asian cultures, the Hispanic Latinx cultures, and then Islamic etiquette during home visiting. So those are our cultural competency trainings. And for the outreach that we did, like I said, we targeted the Hmong and Hispanic families and conducted orientations, and we're continuing to do that. We're partnering with Kelly's here from Warmline, the Family Resource Center. We're in touch with Family Soup in Yuba, Colusa. We're partnering with the Southeast Asian Assistance Center, the Health Ed Council in the Mexican Consulate. And we're now working with a nonprofit organization for Russian mothers and for a potential exchange of information. They want us to go to them to talk about what ALTA provides, and at the same time, they're willing to come to us to, let us understand what the Slavic culture is about. And while doing all of the outreach, I think it's also important for us to know, are we making a difference? And so to do that, what ALTA did is we printed the number of clients, of the target population that we have, Hispanic and Hmong clients. We printed those clients in April of 2017, and then we started tracking their use or access of services. As we go out, as we did the cultural competency training, we also kind of like take a look at, okay, are we making a difference? So it's looking positive, I'd have to tell you. We started with the 71 Hmong clients, no POS, and you can see in August of 2017, you have 6. It's very slow, increase, and 10 in September, and then 12 in December. And then we started with the Hispanic Latinx clients with 81 no purchases, and by December of 2017, you can see that there's now about 30 plus that now have purchases. And actually, I looked again in July of 2018, just last month, and we've seen an increase that now the Latino clients actually now have more POSs than no POSs. Now, I'd love to claim that that's because of our efforts. I would love to claim that, but, we are very aware that it could be, other factors could be contributing to that, but we're hopeful that the cultural competency training that we did, the outreach that we did, and continuing to talk with our service coordinators and partner with the communities, that is contributing to the increase in purchase of service access. And so for 2017-18, there's another grant, the $11 million was again given to the regional centers, and at this time, community-based organizations were allowed to put in for the grant to also, create activities, implement activities to try to bridge that gap. And so for ALTA, we were funded for a service navigator program. Same concept as the PROMOTORAS program. We partner with Warmline, Kelly's group. They hire the navigators, train the navigators. We do the referrals, and I'm very proud to see that one of our navigators is here. And Kelly is here from Warmline, and Violetta is here. She is our Hispanic navigator. And Lakeisha, hey Lakeisha. So we target the African American and Hispanic Latinx population. We also want to hire a Hmong and a Russian navigator, but we're still looking. And the program has taken off. As of today, I know that we have 9 clients approved to receive a navigation program, African American clients, and then we have 11 for the Hispanic clients. And the navigators, they do more of the hand holding. They assist the families in almost everything, looking for day programs, understanding regional center services, translating if necessary, and attending IEPs. Those are things that they do, because see, our service coordinators have caseloads of like 80 to 90. They can't always do these little things that the navigators are able to do. And the navigators will have a caseload of probably about 20, 25, 50, if we're lucky. Yeah, so we try to do this, and we're hoping that that will have an impact, and we will track those. We'll track the families' services right now, the regional center services and generic services, Then we'll also track the increase in POSs, hopefully to see that we've made a difference, because it's also important that we see that, okay, our efforts are paying off. So that is my presentation.
So before I talk more about the activities that we just heard about, I want to start off with a foundational question that I think we really all must start off with when we are engaging in transformational change, right? Anytime we're going into big endeavors, we have to always start with the why. And so some of you might be familiar with Simon Sinek's work about starting with the why, knowing the purpose of why you do things, the bigger picture. And we know that through historical accounts, through research and lived experiences, that disparities and accesses to services are a reality for many communities of color, or what some might call racial or ethnic minorities, but I don't personally like that term, so I'm going to say communities of color. So sociologists actually have a theory called racial formation theory, and it tells us a little bit about the construct of race and how it inherently implies a hierarchy in a distribution of resources and political power, and how that is the tripod, like the three-legged stand of the foundation of racial classification. So these artistic expressions we see here are just evidence of some of that historical trauma that have happened to various communities of color. Whether it's the picture of the Trail of Tears for our Cherokee Nation, the Secret War in our Hmong community, the painting that we know as The Problem We All Live With, that describes racial segregation for the African American community, or the farm worker struggle in the Si Se Puede picture that's really describing experience for many of our Latinx brothers and sisters. We know that these communities have had a history with injustice, but what does this mean for families and communities who have children with disabilities? It means that they will have additional barriers and issues that must be addressed and to adequately support them and their children. And addressing those barriers is exactly the why that really my esteemed panel has described them attempting to tear into. So looking at some of the presentation, some of the material that was discussed in our panel, once again, we really did see evidence of individual regions looking at and remembering the why and following up with action that is data-driven, inclusive, and intentional. So Larry in Far North Regional Center gave accounts of efforts of using that data to address the barriers that many of our Latinx families and our Asian families in that region go through. He discussed a common theme that we saw in many of the other presentations, that lack of information or misinformation, also steeped in stigma of disability, being an issue in that region. And not just having head knowledge about it, but doing something about it. Also discussing the lack of linguistic diversity within regional centers and how within providers and within vendors leads to communication chasms for our non-English speaking families. Also, the issue of mistrust came up several times, and lack of culturally responsive practice, which all perpetuate weak relationship between intervention staff in regional center staff and communities of color. And lastly, Larry even highlighted the Far Northern's use, and also Carlos, the use of PROMOTORAS, and the use of cultural brokers to reach our Spanish-speaking Latinx populations, and provide them with a cultural capital that is necessary for them to be able to navigate these service delivery systems. Carlos in Valley Mountain talked about the strategic planning that went into hosting outreach community events and the ways that they were very intentional about making meaningful programming to be family-centered and person-centered, breaking down the walls of separation and hierarchy to make regional center leadership accessible with such activities as the coffee with the boss or El Jefe. You'll love it. And he emphasized the need to collaborate and engage in meaningful communication with community members to reestablish and even establish trust and partnership. And Helen discussed their efforts at Alta to train their staff to be more culturally responsive to families and to serve as community partners and team members, and really collaborating with partners such as Warmline to be able to put together the types of direct supports that will directly support families who have children who are transitioning into adulthood. All of this is illustrating that really nothing is impossible when you have people that put in the effort to really look at what the issues are and making thoughtful plans to address it. So we actually saw in all three presentations examples of a concept known as cultural brokering being used. And this is the strategy specifically used, that they use to be able to address these disparities. And whether it's using promotoras or coaches or even people within the regional center that were able to work as cultural liaisons, cultural brokering, the definition really is to be able to bridge, make a link, mediate, and to be able to help groups come to a common ground. And the purpose really is to mediate, but also to reduce conflict and produce change. And our definition of cultural broker is a person that is a go-between. It's a linker, an advocator, someone that can be able to speak on the behalf of an individual or a group. And it can be very important for regional centers or places that do direct support with families to understand how powerful culture brokers really can be. They can be language interpreters, they can be mediators, they can offer information for within group differences among communities of color. They also can be able to help train and provide support for staff within the regional center to understand what are some cultural things that are very culturally important to communities. It is very clear that cultural brokers are needed and to reach underserved communities, and I think we saw this as an apparent in the panel. And they help build bridges that mistrust or historical trauma has either torn down or not allowed to be built. And they can provide linkages really to make that family and allow that family to become the advocates and to become discover the agency that they have to navigate these very, very complex service delivery systems. So what's key about all of that is that when we are tearing down those barriers, we're building up relationship. And those relationships serve as the foundation for families to be able to be more effective throughout the course of that child's life, understand their role as being that child's champion and encouraging that child to be their own champion throughout their whole life. So it's a really key part. That relationship, it's a modeling experience.
The UC Davis Mind Institute was created in 1998 with a promise to find cures for neurodevelopmental disorders. Every day, our physicians and researchers come closer to fulfilling that promise. Their groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other brain disorders are helping children achieve their fullest potential. Please visit our website to find out more about current studies, upcoming events, and how you can help make a difference.